All right. Can you all see that?
Yep.
Good. All right. Okay. So let me see how I advance. Okay. So for the next hour and 25 minutes, our focus is going to be on our response to COVID. Why are we talking about this? I spoke about this a little bit earlier, but the COVID pandemic re-highlighted some of the problems within our food system, that our food system does not support marginalized minority groups. Those are the groups who are hit hardest by the pandemic. So I'm going to invite our panelists to talk a little bit about their organization's COVID response efforts, achievements, challenges, and share stories not just about the hunger and food insecurity that we saw, but most importantly, the hope and the resilience that we witnessed throughout in their work and in their communities. So here's a breakdown of our agenda. We're going to go first through individual presentations, about 5 to 6 minutes per person. We're going to have some moderator questions. We'll have some time for audience Q&A, and then we'll have a final question for the panelists and then our closing. Because we can't see the audience members in this format, I invite you guys to put your questions into the chat, even if we're not in the Q&A portion of the panel. We may or may not get to all of the questions. Actually, I can guarantee you we won't get to all the questions. But the panel, I'm going to start off with some questions and see where the discussion goes. And we may have the opportunity to incorporate some of the audience questions into the moderator part of the discussion. So feel free to share your questions in the chat throughout the discussion, and then in the Q&A, we'll go to that chat for any questions, and hopefully you guys will feel comfortable to share those questions again if we don't get to them, but then also I'll share contact information at the end for any follow-up. Okay, so enough about me. So I want to welcome and introduce our panelists. We have 3 of them today, and I'm really excited that they're able to join us. You see them on the screen. I'm going to introduce them a little bit more in depth right before they present. But here they are, Matt, Roberta, and Josh. Matt is representing Dot Mobile Grocer based in Kansas City, Kansas. Roberta is representing the Fresh to You mobile market housed within the Chester County Food Bank in Exton, Pennsylvania. And then Josh, like I said before, is my coworker at About Fresh based in Boston, Massachusetts. So thank you guys so much for being here, and we're really excited to have this discussion today. Okay, first up is Matt. Matt is a PhD candidate at Kansas University. He's a research assistant at Children's Mercy, Kansas City, and he's also a facilitator with the Dot Mobile Grocer. He co-founded Dot Agency, which is a community design studio at the University of Kansas. He facilitates the shared governance framework that the Mobile Market Community Council uses to lead Dot Mobile Grocer. And I had to share this because Matt shared it with me, and he shared a photo. He was on the 2008 Kansas University men's basketball national championship team. I just found that extremely amazing. There he is on the right. But with that, I will hand it over to you, Matt. And I have your slides, so you can just tell me when you want me to advance.
Sure. Thank you, Megan, for reminding me how much in better shape I was 13 years ago. So thank you.
Anytime.
Well, now I feel exposed. So I'm really excited to present with this great panel. Roberta and Josh have been, I've looked up to their leadership in this space for a long time. They are each doing incredible work. And I know many of you on this call as well. And I'm really excited to just be in this space with you all together. But Megan, thank you for the introduction. And I won't repeat any of it, but the facilitator word I use for the Dot Mobile Grocer is a very specific choice because I don't have any decision-making power in our mobile market. I am here as a representative of the Mobile Market Community Council. And I say that because Davita's keynote was incredibly inspiring. I thought it was exactly the kind of message that our community council has been feeling, and she articulated so well. So thank you for that, Davita. But for the last few years, we've been in this sort of experiment in democracy where our residents from Wyandotte County, Kansas, who have agreed to participate as members of the Mobile Market Community Council, have taken on decision-making ownership and power, and eventually they formed their own nonprofit to literally own and govern the Dot Mobile Grocer, which is the mobile market that we've launched in the last year to address COVID in our community. But there's a lot of other background and context. But for today specifically, I'll talk about our experience with COVID. But I want to just highlight that this is a community-owned and led operation. We work through consensus and consent. There are many discussions that happen frequently so that the community members are in coordination with each other. We use technology like Slack and Zoom, but a lot of just face-to-face meetings pre-COVID to build up trusted relationships so that it is a community-led and owned enterprise. It didn't start that way. And so we'll talk about more about that tomorrow in the community engagement panel that I'm helping host. But I just want to share, if any community council members are in the chat, they really are the leaders of this. I don't always agree, if I'm being honest, and they know it, on some of the direction they take. But one of the decisions they made was to do what I'm about to present to you all in terms of how to get food to the community. Not that I disagree with them, but it wouldn't have been what I chose. But this is what the community chose for itself. And that's the model we've tried to live into with Dot Mobile Grocer and the Mobile Market Community Council. So this is really their effort, their work. I'm just pleased to present it. So next slide, please. What got us started with COVID initially was we got a call from a community partner, and they said, we want your truck to be the billboard for the USDA food boxes that we were handing out through the Farmers to Families program. We had no idea what it was. We had talked about trying to get Dot Mobile Grocer up and running. We've been planning it for years, but there hadn't been like the right time. And when the pandemic hit, it kind of shut everything down. We were in close conversation with many of you in the summit today about the best way to move forward. But what eventually took place was community partners started picking up food boxes around our county. We started working with them very closely. And we were really excited when the CARES Act came out because it gave us an opportunity to hire full-time staff members. Through that program, we have been able to distribute our own food boxes, and that's continuing to this day until the end of April at the latest, before we transition into selling food. But it really has been a community-led effort. We go to many locations around the community, and that's what the next slides we'll talk about. Go ahead. So just by the numbers, the food box program started, as many of you know, last year with COVID. We were not initially in that space because Dot Mobile Grocer is so new. We're still waiting on the IRS to approve our 501c3. We are fiscally sponsored, however, by Groundwork NRG, a local neighborhood organization that really wants to see improved access to healthy food. And so through them, we were able to receive food boxes starting in October with CARES Act funding to hire 2 full-time staff members. And we were able to increase it. We carry about 120 food boxes every day. The Community Council's desires for the Dot Mobile Grocer to be a consistent community presence 5 days a week, every week, every year. And part of that with COVID was being out there consistently, making it 3 to 4 stops a day. So through that, we've distributed over 11,000 USDA food boxes, a value of about $500,000 based on how you break down the cost of each box. But a lot of where we're going is community partner locations. We get requests all the time from community partners, and it's been really kind of a great experience getting to know new partners in this space who've reached out to us to have us bring food to their locations, which are very, urban, diverse, food insecure, and really areas that just don't have a grocery store nearby. And so being able to serve the needs of the community is what the community council has tried to do. Next slide, please. So one of the things we've done is use a food insecurity screener questions that Children's Mercy Kansas City Hospital helped to develop, and they use with their patients. But it asked the question about, are you food insecure? And what we found in the community we're serving is it's about 90% of the folks that we're reaching struggle in the last year to get food, whether 86% actually reporting that they did run out of money before they had enough money to buy more food, and 93% being worried about it. So this is a huge stress point. Obviously, you all in your own communities are experiencing food insecurity in different ways, but it's something that we've been trying to track and measure, both to know that we're meeting the need, but also to communicate that to the funders of the Dot Mobile Grocer. We did that through QR code surveys. Noelle, our manager, has been an unbelievable presence in the community, handing out these surveys and food boxes and getting really good responses. in terms of what people are struggling with and where we can go next. Next slide, please. And so this is just a kind of a wrap-up slide, but it's where we're going next. We've been fortunate because of COVID, because the mobile market is community-led. Funders are coming out to direct new resources to food access. We've had a number of funders just in the last few months who have said, we want to support the community-led work that you all are doing. So with COVID, I think we're going to move into wrapping up food boxes in the next couple months, and then really transitioning to being what the Mobile Market Community Council wants, is another point of food access in the community. So that's my slides, and thanks for the opportunity to share more.
Awesome, thanks, Matt. All right, we will move right along to Roberta. Roberta is the manager of healthy food access programs at the Chester County Food Bank in Pennsylvania. There, she oversees the Fresh to You mobile market and their fruit and vegetable prescription program. She is a first-generation American, and her passion for food and community comes from her Italian family. She's lived in Pennsylvania for 13 years and has an unrelated passion for home renovation and power tools. That is awesome. And with that, Roberta, I'll hand it over to you.
Thanks, Megan, and thanks, Matt. That was so great to hear about what Dot Mobile Grocer is doing, and it's actually very inspiring for our work. So I've been, like Megan said, I've been with the Chester County Food Bank for just over 5 years now, and this program has, the mobile market has been in operation since 2015. And since we were asked to kind of come on this panel and talk about our pandemic response, as I was thinking about what that looks like, I felt like I had to talk a little bit about what we looked like pre-pandemic as well. So those are the pictures that you're looking at now. This is our mobile market pre-pandemic. As you can see, as you can imagine, it looks very different now. But I just wanted to talk a little bit about what the response was from the organization in early 2020. As you can all imagine, Davita's talk earlier really hit home for me personally, because while we are a mobile market, we do live within the larger organization of the Chester County Food Bank. And the Chester County Food Bank has been around since 2009, and it is the central hunger relief organization in Chester County, Pennsylvania. We have long recognized that the charitable model of food delivery systems is inadequate to meet the social determinants of health that Davita mentioned earlier. And so the building of the mobile market was actually partially in response to that. So along with the mobile market, we also do cooking classes throughout the community. We do raised bed gardens throughout the community. We have a couple farmers on staff who grow the food that we deliver throughout the county, but also some of that food is delivered through the trucks, through the mobile market. So while we are a food bank, we have tried to really expand what that actually means. And as Davita also said earlier, really defining the question and making sure that we were getting to the root causes of poverty as best as we could as part of this organization. And so when COVID hit in early 2020, it wasn't so much an existential question for us as to what to do. It was kind of an insider look into what happened at the food bank. I would describe it as, this is what we are meant to do and deal with. And it was a call to action for all the staff here. You know, for the past decade or so, while we have been in existence and growing, it's always been a question as to the importance of the organization and how are we best serving the community and all of that. And in a very strange way, the pandemic reinforced the importance of the organization. And so we kind of went into a lockdown, and, you know, we had to close off to volunteers. We all got together as staff and decided what our priorities were at the time. And that was putting food into boxes, delivering them, making frozen meals, delivering them. And that's what we did. And the mobile market operations kind of took a sidestep for, I would say, a month or two while we all kind of went into these different roles. And eventually the question kind of came up whether the mobile market was really needed in the community, or whether we should continue as we were doing, which was creating frozen meals and creating boxes of food. So for some people within the organization, that was a bigger question than for others. And so what we decided upon as a group was that we would kind of do a slow rollout of the mobile market. So we actually started out in mid-May bringing out the Farm to Families boxes. So Matt mentioned those two. Because we are a food bank, we already had access to those boxes. We were already delivering them. And so our mobile market vehicles were just another opportunity to get out into the community delivering those. And we used that as a chance to kind of gauge what the community response was. Is this what they need from us right now, or is it not? And we did that for about 2 weeks, and our regular customers who would normally find us made it pretty clear that this was not just what they wanted. So we ended up creating our own produce boxes and packaging them and selling them for $6. And we did that in conjunction with the Farm to Families boxes for a couple of weeks. And that worked out fairly well, but it was very confusing for staff, for volunteers to kind of differentiate the Farm to Families boxes and the produce boxes, and which one was coming from where, and why is this one $6 and this one is free, and that sort of thing. So it was definitely a challenge. Eventually, a few weeks after that, we increased the number of boxes that we were carrying. We carried 3 separate boxes. As people gave us more feedback, we realized we needed a little bit more selection. And also we were coming into the peak of the summer and we had tons of produce available to us. So we just wanted to keep going. And then eventually we went to the model, which I'm going to show you now, which is that we ended up with customers who could come to the market in almost like a deli style format and order the produce that they want. So this again is pre-pandemic. If you go back one slide, this is kind of what our display would normally look like. And then the next slide shows during post-pandemic what our selection looked like. So it was quite a change for us to go from this beautiful display to, okay, now we're just trying to display one item of each thing and let people tell us what they want and we will get it off of the truck from them. And the last slide here is just, I have a couple of slides just kind of showing the overview of what our operations looked like during this time period. So you can see people are coming up to the table one by one as they're waiting in line. We kind of put X's on the ground for 6 feet distance, and staff and volunteers were inside the trucks packaging orders off of like guest checks basically. So it really was like a deli style. And that's how we ended the season. And we have now come kind of full circle. We've just finished up doing some winter markets, and we are back to, based on our customer response at the end of our survey, at the end of our season, customers said that they wanted to do their own shopping. So we are back to customers kind of picking their own food off of the truck and doing that safely.
Awesome. Thanks, Roberta. All right, moving right along, we're going to Josh. Josh is one of the co-founders and the current CEO of About Fresh, a Boston-based nonprofit that builds programs that integrate healthy food into community healthcare systems. At About Fresh, he leads the fundraising, partnership cultivation, and new program innovation. And initially, he was inspired to start About Fresh while working at a community health center, and where he encountered food insecurity among his patients after the only grocery store in the neighborhood closed down. And he is a Massachusetts native, grew up with his mom, his grandmother, and some extended family. He is an avid and good, I attest to, soccer player. And he is an enthusiastic Special Olympics soccer coach as well. And with that, I'll hand it to you, Josh.
Thanks, Megan. If you could just fast forward to our first program slide there, right ahead, that'd be great. I'll give a quick overview of the work that we do. I think our mobile market fundamentals are the same as Matt and Roberta. They gave a great overview of that, and I think we're all familiar there. But just at a high level, one thing that might be different about us is that we have an outsized focus on partnering with health systems. We really think about how we can integrate all of our programming into community healthcare systems across two verticals. One is focused on culture and proximity, bringing healthy food closer to communities and really lifting up neighborhood food culture. We do that through our Fresh Truck mobile market model and through our newer program that we developed at the onset of COVID, FreshBox, which is a direct-to-doorstep delivery program that I'll tell everyone about. And then another vertical of programming that we're really excited about is focused on increasing the purchasing power for healthy food across our low-income, food insecure communities that we serve, and then generating really powerful data and analytics that can help us build a case for policy change and broader systems change across healthcare to inspire deeper, really long-term investment in food as a social determinant of health. So Megan, if you just go forward to our next slide, we can show what we looked like pre-pandemic, not altogether different from Roberta. You can see that our mobile market is constructed in a way where you walk on the truck and you go shopping. We all know this is a perfect vector for the transmission of COVID. And I just want to pause here and say that, I'm one of our founders. I really deeply care about this work. I've been close to this work for a long time. I started out, I built the trucks, I ran the trucks. I have regular shoppers that I'm still in touch with, that I stay in touch with. I still work the trucks. At the onset of COVID, I was totally lost at what we were going to do, and I was completely unsure as to whether or not we would be able to continue serving, which was scary. It's probably the scariest moment in an organization, like from a mission standpoint. And in that same breath, I just want to express sincere gratitude to Megan for her leadership in this moment at the onset of the pandemic. In a matter of 2 weeks, first recognizing that it was imperative that we shut down our trucks, and then two, rallying our entire team, our community, and our partners to reimagine our mobile market model, which you can see here. So what we did is we hired more staff to support social distancing, and then implemented just a wide range of measures to continue to serve our communities, not still offering the same degree of agency and choice over the food that they always get in purchasing food from our trucks. So as you can see here, everything's happening on the exterior of the truck, except our shoppers are able to still choose all their food from the menu that you can see there on the right side of that slide, but we do all the picking and packing. So we're taking out that element where shoppers are walking onto the truck. We're back up to our same amount of mobile market sites. We have 3 trucks on the road right now, a 4th one coming online this spring. And we'll do about $1 million in sales this year. And Megan led all that work with one arm tied behind her back. So exceptionally thankful to her. Probably the larger part of our COVID response work was our FreshBox grocery delivery program. You can see sort of pictured here. Not dissimilar to Instacart, Peapod. We began shipping direct to doorsteps 40 pounds of pre-packed, 2 different types of boxes, but pre-packed fresh produce and grocery staples. We were a really big part of the city's response effort. And one of the special parts of the work that we did to construct FreshBox was, as opposed to taking on all the direct operations ourselves, on the back end, we outsourced all the sourcing and the packing to our wholesale partner and really leveraged their operational infrastructure and their labor force, their $100 million business to pack all the boxes so that we didn't have to scale up and manage and hire all of our own staff. At the same time, we were helping them sustain jobs that were otherwise lost during the pandemic. And then in order to manage the operationally demanding direct to doorstep delivery going to people's homes, we tapped another organization called ABC Transportation that is specialized in that fulfillment again, so we didn't have to buy a ton of trucks. At the peak of COVID, we were up around like 5,000 direct to doorstep deliveries a week. And then in between facilitating all of the enrollment and the delivery planning, our Fresh Connect team, who is responsible for building out our Fresh Connect produce prescription program, really pivoted towards using our HIPAA compliant platform to develop an enrollment process that worked for our healthcare partners, that worked for the city, and then paired that with a route optimization platform called Routific. I would highly encourage everyone to check out. That's doing this work that created the efficient deliveries every day for our fulfillment partner. So again, you can see out of all of that work, it was like a team effort, really rethinking our jobs throughout the course of COVID. And just to be clear, like FreshBox didn't exist. It launched just about this time last year. So in a year's time, we've shipped about 150,000 boxes, and reached 30,000 unique households. And I'd say probably about a quarter of those boxes, or actually, I guess over half of those boxes too are direct to doorstep, which is, I think the most challenging part of this work, as we all know. So I think I'll pause there. Thanks, Matt. Thanks for Roberta for adding so much color, and Megan, thanks to you, of course, for your role in all that work.
Of course. Thanks, Josh. Okay, so before we dive in, I just want to do this quick activity with the audience. So I just want to get an idea of what the audience is kind of looking for in this panel so that panelists and I can help direct that conversation more towards those things. So here's 2 ways to participate. You go to this website. I'm about to go to the website itself, so you'll have instructions there as well. Go to this website, enter the code, or you can scan the QR code that's on your screen right now, and it'll pop up with this question. In one word, what aspect of our panelists' COVID response efforts are you most interested in learning about today? So I'm going to direct to the website. Let me just get out of this screen. So here's the question again. So the instructions are up here, www.menti.com. Use the code 7228578, and you can put in multiple responses if you want, but one word to describe what you're looking to learn from today's panel. You can also insert a comment. I think there's a comment section on the bottom, which will pop up over here on the right. And it's just going to create a word cloud for us. I see sustainability coming up a lot, funding, scalability, personalization, partnerships. This is just to kind of ground our conversation, and hopefully panelists, you'll be thinking about the things that are popping up here as we're going through the discussion. I'll give it a couple more seconds, and then I will move away from this very exciting moving word cloud. So funding, sustainability, online ordering, post-COVID, technology, promotion. All right, awesome. Thank you guys for participating in that. I'm going to close that out and go back to the presentation. Actually, I'm not going back to the presentation. We're just going to, we can see the panelists now. All right. So the question I'm going to open up with, and again, audience members, if you have questions, I'll have the chat up. I'll be monitoring the chat. So if you have a question and the discussion kind of leans that way, we'll pop those questions in. First of all, how did you figure out what the gaps were? And how did you figure out, who did you talk to figure out those gaps? And how did you decide what to do first? I'm sorry, those are 2 very big questions, but first question is, how did you figure out what the gaps were? Who did you talk to? And then how did you decide what to do first? I'm going to call on someone. We won't necessarily have everyone answer every question, but then after that, you can just feel free to jump in where you want. So we'll start with Roberta.
As you're asking that question, I'm smiling because I'm thinking about the entirety of last year, and it felt like we were just throwing, arrows at a board and just seeing what stuck. And earlier this week, our team was kind of reminiscing, talking about last year, talking about this panel, and all of us kind of agreed that that was the probably most difficult part of last year, was just the trying of new things. And that's really the only way that we were able to learn about what the gaps were, how we could recognize them, how we could meet the needs of the community that we were trying to serve at the time. We have 120 partner organizations throughout the county, and everybody simultaneously was going through the same thing and just trying to figure out what those needs were. And so really for us, the only thing that we could do was just get out there. And we tried a lot of things. I saw online ordering show up. I saw technology show up. We tried all of those things. And to varying degrees of success. So, if we end up talking about that more, I can go into more detail. But yeah.
Do you want one of us to go next, Megan, or are we waiting on you to call us?
Either of you can go next.
Well, I can just, answer somewhat briefly. I mentioned earlier that I wasn't quite sure what the Mobile Market Community Council wanted, but that's one of the benefits of having a Mobile Market Community Council, is that the residents in the room making decisions have the experience of working with other residents and serving as they can in the spaces that they're already in. So we really leaned on them to make the decisions. And, Davida said earlier, solidarity with mutual aid. We're fortunate that our Wyandotte County Mutual Aid has representation on a Mobile Market Community Council. We have a geographic distribution of folks. So it's not just one neighborhood or one community represented. But I think for us, the initial idea was, don't do anything. It's too dangerous. It's too much of a risk. Liability, this is before we understood how COVID was being spread, or how, what it would even look like. And then within about a month, I think we all realized, well, either we're going to sit on our hands and do nothing, or we're going to use this as an opportunity to live into what the Mobile Grocer wants to do. And the initial idea was partner directly, because the Mobile Grocer at that time was just a truck and a incorporated nonprofit in Kansas, but not a 501c3. So the logistical barriers to start serving the community was too much for a fledgling mobile market. But the leadership of our community council said, don't partner with another organization. This is the community's project. Let's do it ourselves. Let's actually respond to the need. And so they took the time to plan out what that would look like. Starting small. There's a model of kind of community design work that I do through the DOT agency, where I kind of came out of, that calls it small bets. And so it's really kind of prototyping, adapting, refining at a small scale, and growing from there. And that's the approach we took by working with our partners, first on a weekly basis. Then it became a little more consistent, but then we had some setbacks. And so we kind of retooled consistently. But the CARES Act funding really did get us to where all of a sudden now there's staff have opportunities to take ownership and really push this forward. And the community council said, let's revisit our original mission, build the relationships, and use it as an on-ramp. So they saw COVID both as an incredible need in our community. The food banks weren't enough. Mom and pop nonprofits overnight were bringing in food boxes. But when round 2 ended just fresh produce and went into milk and dairy, the Mobile Grocer became even more critical because of the need for refrigeration. And all these nonprofits who had put food boxes on the asphalt couldn't do that anymore. So Mobile Grocer stepped into that role as best it could to carry more food boxes on a more consistent basis. So it's really been kind of trial and error and listening to what the community wants, but trying to continually move forward even when there's setbacks.
And then on our side, I think the first thing that I did was look inwardly toward our team to reimagine what it would take for us to serve. I don't think it ever crossed our mind to stop ever. first and foremost, we knew we had to protect our shoppers, and we knew that the existing mobile market format was, again, perfect vector for the transmission of COVID. But we just got to work straight away, reimagining what a safe version of Fresh Truck could look like. First, I think working together as a team. Then, we have a network of community partners we've been working with for 8 years on speed dial. We hit them up to sort of collect their concerns, get their insight, get their feedback. They know how we work too. And then we're fortunate to have skilled, engaged, really diverse board of directors that was able to lend their insight. Head of a hospital, right, that really gave us some inside details around how to think about COVID as a virus as we were still learning about it. Let us know what the unknowns were, but let us know what the knowns were, maybe a little bit earlier than we would have been able to learn otherwise. And then, as I alluded to, one of our board directors runs a really big wholesale food business, right? And he lost 80% of his business overnight. And so with that whole group, our community partners, and by way of our community partners, tapping into our shoppers, we have a text message sort of hotline that we use within the normal course of all of our programs. We're able to tap into to collect feedback from our shoppers. We arrived at Fresh Box in the reformatted version of Fresh Truck. And as Matt alluded to, it was just, it was very rapid sort of iteration and prototyping. But we went fast, and then we definitely greeted sort of the development of programs aggressively. We were doing a lot of stuff by duct tape for a while, recruiting 20, 30 volunteers a day, doing everything extremely inefficiently, but doing as much as we possibly could to just serve in the moment ahead of developing, all of the technology systems that I was describing and what has ultimately become a really streamlined supply chain, right? So like, I got a pickup truck, we were just shipping boxes, and within the course of doing that, at the same time that we were serving, we gradually built up our programs and put some systems behind them to enable them to grow and to be sustainable. So tapping into the team first, and then the board, and then looking outward towards community partners and shoppers, and then just learning and iterating on the fly. We're still doing it, I think. Latest innovation from Megan too is online ordering at the mobile markets. You can pre-order and then pick up at the mobile markets, which brought that online just 2 months back, and it's already a huge part of the work we do now.
Yeah. So I want to jump back to 2 words that popped up on that word cloud: sustainability and funding. So obviously you have funding for things that you normally do, and now you have to reimagine the things that you're doing. So how did you approach funding, and how are you thinking about sustaining those efforts over time? Matt, you mentioned the CARES Act. What were you guys thinking at that time?
Well, the CARES Act was an opportunity because we were looking at, we're fortunate to have a very philanthropic minded city, though Davita's comment about charity being the enemy of justice is very obviously on our minds with how that translates to funding. But in the moment, we were originally going to work with our county, said, look, the county has the needs. Wyandotte County is an area that it's kind of the county that white flight left behind in the Kansas City region. But the community, capacity to do what it wants for itself is huge. Anytime something comes to Wyandotte County, there's always the question of, well, is this Wyandotte County led? Is it from this community? And that's something our Mobile Grocer was not initially, but is now. But the conversation on funding was initially, let's work with our county because they were going to receive the lion's share of CARES Act funding. But when we applied with them, they eventually, because of challenges and logistics, they really wanted to focus their funding on the vaccine distribution specifically. And so we took some time, we tried it out. They got funded, but they cut us out of the deal. So we reached back out to the Greater Kansas City Community Foundation and the Hallmark Family Foundation, and we had other previous grants. And one of the things I think we did that was unique was we actually just brought the potential funders into the room with our community council. And so residents sat there and described what they were seeing firsthand, helping with the Mobile Grocer, what was happening in the community. And it was trying to let the funders know what was happening on the ground from the residents that were motivated to respond and directly impacted by it with the communities that they were serving and a part of. That brought in $100,000, just one meeting with our funders directly, which will help give some sustainability long-term. Now, I don't know if that's because of our COVID response or because of that community-led approach. I think it's probably a mixture of both. But I do think letting those that are most impacted and most at the experience be a part of the decision-making table, I think is absolutely a part of how we've tried to address the sustainability question.
I can talk briefly about funding. I mentioned this in the networking session also. I agree with Matt completely. We work closely with our county health department, and at the time when during COVID, a lot of the programs that they fund were unable to operate, and so they were looking for opportunities to fund supporting communities during COVID. And so we were able to tap into some of that funding just for dollars for food. So we were able to purchase food from local farmers to a larger extent than we have ever in the past. So we were able to pass on some of that support to our local growers. And we were also able to hire community food advocates. This network actually helped us develop that program. So thank you to all of you who did that. We pitched it to our community, our public health department, and they were super supportive. So we actually hired community members to work with us out at market. And it was really a great success for us, and a way that we were able to communicate with the people on the ground and really understand what the needs are and really expand on what our impact was in the communities that we're serving. Chester County is pretty large. So for us, we're not just one community, we're several. So that was a great touch point for us. And so I'm a big supporter of our public health department, who's a supporter of us. And because we're part of the food bank, we're also fortunate to have that funding. So foundations are great access points for us. Generally, their funding is a little bit more flexible, especially during times like these. So, and private donations also are extremely helpful during this time period. Right now, we're looking at a couple of different grant opportunities to kind of expand on things that we've developed during this past year, namely the technology piece and helping us connect to partners and partnerships that we've developed over this past year. Again, mostly focused on growers and other small retailers that we can support.
Yeah, on our side, I think, and we carry this philosophy always that, funding follows, good work. And I think that was particularly true throughout the course of COVID. We didn't think a whole lot about fundraising from the jump because there was so much work to do. And we were a one-person development operation back then. But, out of the work that we did, I think to react quickly to COVID, and to reformat Fresh Truck, our mobile market model, and then to engineer Fresh Box. What followed from that was investment from the city at a scale of what's ended up being $7 million of contracts to deliver as part of their sort of city-sponsored COVID response, specifically thinking about how they support the highest risk households. And COVID positive households that they were asking to stay at home. They really tapped us to do their direct to doorstep delivery. And so again, that funding really just was a function of, I think, the good work that Megan and the team put in up front to build a scalable program. And sort of in that same vein, we think about sort of funding and operational efficiency and sustainability all hand in hand together. Which is what led to our choice to outsource our sourcing and our packing on the back end and the direct-to-doorstep delivery on the front end. Both of those choices made the program more expensive in nominal terms, but much more scalable, right? We couldn't have delivered as many boxes or lived up to meet the needs of the city and also our healthcare systems if we attempted to scale the program just based on volunteers. nor would we have been able to attract that level of investment from the city. And then I think similar to Matt and Roberta, as they both alluded to, that work with the city, the overall response, the thoughtful design of the programs resulted in additional follow-on investment from foundations and donors that were just looking out for the groups that were, doing the most work during COVID. So, we were fortunate enough that we were able to focus on the work, and there was a lot of just inbound support that came behind that. But I'd say the last thing I'd add to that is we intentionally chose not to tap into the Farms to Families Food Box program through the USDA because of the operational constraints that came with that program, and then the limited amount of choice we had to control the inventory. It's a great program in a bunch of other ways, but it really didn't fit the framework that we had developed around FreshBox. It would have been too much of a departure from what we had already built, and we were obligated to the city and obligated to our health systems to deliver on those contracts already. So we left that to a few partner agencies around Massachusetts. But yeah, I would just say, like, even though, again, in nominal terms, our program is more expensive to deliver on than ones that are driven by volunteers, I think we're able to develop like a higher degree of efficiency and scale to sustain the program, and then also deliver with like a high degree of like efficiency and reliability. Less than 1% of our direct to doorstep deliveries at this point in time are missed, which is a number we worked hard to drive towards. I think by all standards is a pretty good metric to stand behind. So yeah, I'd say alongside of just funding, we think about that hand in hand with the operational design.
So one of the other words that popped up in the word cloud was partnerships. Is there a partner that stands out in your mind that was crucial in your response, or that really kind of was essential in how you did your work?
I'll just add, I think a partnership that emerged, there were two specifically for the Dot Mobile Grocer. The first was an organization by the name of Young Women on the Move. And they were so active doing the work that they reached out to us. They came to us and said, hey, we're already doing food boxes. We're already serving the community the best we can. We need help. And that relationship, I think, has been very fruitful. They're doing amazing work. They are, applying for grants, trying to find ways that the young women that they serve through their empowerment and cooking classes and whatnot are potentially going to be partners down the road for Dot Mobile Grocer. The community council still needs to figure out what that looks like. But I think when, they see the Mobile Market Community Council as their neighbors, the partnerships come a little bit easier than seeing kind of a larger institution coming in and saying, this is what it takes to be a quote unquote partner. But I will say that the other partner that we have, and this is what I would recommend to any mobile market that's looking to start out, is really looking at where your whole food distribution comes from. And I want to acknowledge that Davita's question in the chat is a really good one about equity. And I think that's worthy of its own kind of discussion from us. But specific to where food comes from, we would have been, dead in the water without a wholesale distribution partner who's willing to work with us and adjust to the constraints that we had. We're a very small mobile market, which I imagine anybody starting out with the mobile market for the first time might be. Get to know your wholesale distribution partner. I know Josh mentioned they have one on their board. That's an incredible resource because the logistics that go in to running a mobile market require some very high level awareness that we just didn't have. And so having a distribution partner who is willing to sit down with us and explain, okay, here's what it's going to look like. We can work with you on this, this, and this. Let's build relationships and partnerships in the future. That is invaluable with the mobile market, knowing where you get the food. Now, some mobile markets I know are much more community garden based, some are much more farm based. For us, our community council said we want to ultimately serve the needs of our community, and that means having consistent access to fresh, affordable food. So that's where the wholesale distribution partnership matters the most for us.
Other partners? Otherwise, we can move to the next question.
I could say, Megan, Kathy, we have a few community partners. Anytime we're doing something new, we tap into them. So when we were figuring out the fundamentals, particularly of direct to doorstep delivery, we tapped into like one of those kind of like anchor close community partners that we knew just had like the operational horsepower and the ground game to figure out just like the soft edges of like walking into an apartment building, knocking on somebody's door, and then like safely handing them a box, and then the feedback loop of communication to make sure that we were collecting the right amount of information at that point of contact to either recycle a delivery, get it to a new place, or just figure out from there what the preferred mode of communication was going forward. There was just a lot of stuff to figure out around the edges. So a community partner like with ground game that like runs deeper than ours even was really valuable from the beginning. And then as Matt alluded to, like those higher like supply chain partners or institutional healthcare partners that have institutional resources were super valuable as well. I'm providing that like expert level support and sort of top down insight around food supply chains and how they were evolving. Latest data around COVID transmission, mask wearing, right? Like that was an unknown for a long time. And then our healthcare partners, and through the enrollment platform we set up, were literally sending us the households and patients that were either COVID positive or highest risk, right? So being able to tap into literally EMR data to target the delivery of fresh box was supremely valuable to make sure that we were living up to that mission of getting healthy food that people need the most. So ground level, working with community partners as well as those institutional stakeholders were all invaluable for us.
We have several levels of partnerships also. We also do a fruit and vegetable prescription program, and those partners were also super valuable to us during this time period because they were also a direct connection to the people we are trying to serve with the food that we have. So those partnerships have grown a lot as a result of the pandemic. But I have to say again, for us, a result of the USDA Farm to Families boxes was that food prices skyrocketed. So in a normal year, when we would purchase large quantities of food from local growers, because that is a large part of our mission here at the food bank and part of the program to support local food, we saw prices rise pretty high. And so it forced us to kind of expand our network of growers that we work with and places that we get food from. And those are partnerships that I foresee in the coming years growing even deeper, which is something I'm super excited about. We've already been able to connect a couple of local farms that do CSAs with our FERX, our fruit and vegetable prescription partners. So we're connecting FERX participants directly with CSA shares now, which is really exciting for us. So yes, I think partnerships, including everything from the top down, like the health department, the departments of ag, all the way down to our libraries and our cities, our municipalities who are out there, trying to support all of the work that we do too, the YMCAs, pretty much anywhere we go with our truck is a partner of ours, and their connection to people is our connection. So I would say overall, just in general, partnerships deepened quite a bit over the past year.
That's great to hear. So we'll go with one last question before we turn to the audience. So audience members, if you have questions, you can pop them. I'm not sure where the best place is. I have both the Q&A section and the chat open. Why don't we go in the chat just to make it simple? Just pop your questions into the chat and we'll be able to get to some of them. So challenges. What was the single greatest challenge that you faced in your COVID response? What was the hardest thing to figure out?
I think I can just get us started. For the Dot Mobile Grocer, this is the first time people are seeing it. It's been around the community for a bit, but with fits and starts, there's a long backstory of having a nonprofit that got us going, and then they kind of fell apart. And so the community councils had to really rebound, and it's been a journey. But if you ask the community council today what the biggest challenge is, and I think overall it's that there's such a massive need that the Dot Mobile Grocer can't fill, obviously, on its own, or even if it was just doing as much as it possibly could every day, it still couldn't meet the need. I mean, it's such a huge need. But even bigger, and this is sort of to Davita's question or thoughts earlier in the keynote, is what does food justice look like? What does a just food system look like? And the Dot Mobile Grocer, the community council, wants to be a place where you can find a grocery store within a few minutes of where you live. I mean, it is in an area that is extremely food insecure, with some of the highest type 2 diabetes, chronic disease rates. The average life expectancy is 24 years less than the western part of the county. 24 years life expectancy difference on average. And by both meeting the need now, but also looking towards what sustainability looks like in the future, there's going to have to be a lot of conversations. And we've heard this from our community partners, a lot of communication and conversations so people don't feel hurt or left behind when the food box program ends. Now, the food boxes have, there was a 3-week gap between the end of December and when they started up in late January. So, relying upon the federal government to get things right hasn't always been the most reliable approach towards meeting the needs of the community in COVID. I think it's really admirable and smart that what Fresh Truck has done to say, look, the constraints aren't what we want. For us, it was the lifeline. But walking away from the lifeline and walking on our own 2 feet, it's going to be a challenge. And the biggest logistical challenge is just communicating that, really making sure that people are aware and understand and still, feel like they're being cared about, and feel good about coming to the Dot Mobile Grocer. That's the number one thing we've heard from our community partners lately.
I think our biggest challenge throughout all of this was the constant adaptation, which Josh mentioned earlier also, is kind of, we had to look internally first and then determine what our capacity was. And because we're 4 full-time staff members, and we were 4 community food advocates and many more volunteers during this time period. And we're all the type of people who will do more if we can. And so being those types of people, as I'm sure everyone on this call is that you're constantly trying to change and do better. And even in the face of, this super stressful reality that we were all living through and still are, that was our biggest challenge, was just constantly adapting. We have a weekly meeting, and we just needed to change something on a weekly basis that we were doing. Our footprint also expanded quite a bit, which meant that we could do fewer markets and be in fewer places. And equity is a very big question, and something that does come up in conversation in our work and is a focal point of our work, but it's something that we, I think it's fair to say, fail at probably on a daily basis. But it's something that we are working toward, I would say. And so in constantly looking at where we go, why we go there, and when is it time for us to leave because the community can support itself. These are questions that we are always thinking about, but never have the perfect answers to. And I'm hopeful that this year, because of the partnerships that we've developed, can help us get to more equitable solutions throughout our food system here in Chester County. I say Chester County because that's where I am, and this is the local food system that I have the power to affect in this moment. And I can tell you that's what we are working toward. And hopefully just grow on that and expand on it.
Yeah, I'd say quick, before even thinking about programming, like the hardest thing for me, and I think Megan felt this too, is just making sure our team felt cared for in the middle of uprisings, a pandemic, and political instability. We have a team that felt big for us. We've grown quite a bit over the last year. It doubled in size over the course of the pandemic to accommodate like all of our new programs. Just making everyone feel cared for, engaged, feel physically safe. And yeah, just protecting the team and carrying the team was like that was a lot of work. It's something that definitely kept me up.
Yeah. All right. So I'm looking at the chat, and Davida popped in this really good question. So I want to revisit this question about equity, because we talked earlier in the day about the disproportionate impacts of COVID on minority populations. She talks about how the Farmers to Families Food Box program, they purchased $6 billion of fresh produce, dairy, and meat products from American farmers, that a very small portion of those dollars went to Black farmers. So thinking about equity in the supply chain from a national level, broadly, how do you approach your work with an equity framework, or how do you think about equity in the work that you do?
I'll start. Davida, the question I think that you posed here is an important one. I think we need to start off with the fact that there are only 45,000 Black farmers in the United States. And we need to look back at the historic oppression of Black farmers in the United States and probably get at that root cause issue by way of federal policy. And for us as an organization, we think about equity as the conditional state where everyone has the resources and the support that they need to achieve their maximum potential. So we think specifically about health equity, and we think specifically about food equity. So for us, again, as I alluded to with our programs, in terms of like the programmatically, right, by way of Fresh Truck, we bring food, culturally relevant food into communities to make sure people have all the food that they need to be healthy. So that's a design principle for the development of Fresh Truck. And I'd say it's imperfect, which is why we're really excited about the growth of Fresh Connect, which gives people the money that they need to afford the food that they need to be healthy, but extends to those shoppers even more agency to select the day, the time, and the location, like the retail location, to buy an even wider variety of food that's culturally relevant for their family. And we literally have control over the total amount of money that we're able to administer to our households to make sure that they have enough food for their whole household to stay healthy, to at least take care of that part of their life. And then I think the other part of our equity framework relates to our organizational practices. It comes down to how we hire. To what degree can we exploit our financial capital, our workforce opportunities, our media platform to advance equity, right? And so practically what that means, right, is when we think about our hiring pipeline and the networks and the folks that we rely on, we think about the hiring process, right? Like we have systems and structures and practices in place that counter implicit bias, that allow us to use our workforce opportunities, our jobs at About Fresh, to create opportunities for a wide range of different folks that are otherwise exported from the workforce, right? And we pay people good money. We pay people above a living wage, and we have a 403B with a matching program. We pay for 100% of health insurance. And during the pandemic, we paid for everyone's Ubers, right? So that's our equity work, like back and forth to work, right? So if you didn't have a car, right, you weren't resorting to have to take public transportation, which is a privilege given the level that we're funded at. I don't want to discount that. And then, we look at how we spend our money, right? Like there's a lot of vendors, we buy a lot of food, we spend money on graphic design, like we have to look at who we are paying. And that's a major resource. And I think the work I'm really excited about into the future. We have a really great new director of marketing and communications. To what extent we have this huge platform, we have a big national platform. We're on panels just like this all the time. We have all these great corporate partnerships that give us a big, huge megaphone. To what extent can we use those platforms and those opportunities to lift up the voices of our shoppers that we engage with, deconstruct harmful narratives about all the marginalized communities that we serve and lift up like the truth behind the narratives of the rich heritage and food culture that exists across all the communities that we serve that people don't know about. And there's a wider range of other things, but those are examples of how we think about equity and how we lead with equity through our programs and through our organizational practices.
I can just quickly, try to answer. I answered a little bit before, but the Dot Mobile Grocer, its genesis really came in response to the inequitable health disparities related to chronic disease, and that saw us originally just try to evaluate where we were. And in Wyandotte County, we had at that time 15 grocery stores that accepted WIC, but 10 of them were in suburbanized areas that were predominantly white, and 5 of them were in the predominantly Black and Latino communities of Wyandotte County. But those areas had 86,000 residents for 5 WIC grocery stores compared to the 80,000 residents for the 10 WIC grocery stores, and they were separated by a highway. And one of the initial question was, where do we locate? Where do we go to take the Dot Mobile Grocer? And we had seen other models, including the original Mobile Market Summit, that talked about corporate sponsorships and going to places where, you could subsidize the cost in other areas. And I think that's it's a beautiful model, but the community council said we need to go where people want us and where we're going to do the most good and see where it goes from there. And so there's been hard conversations about where is the distribution and access to food most inequitable, and how can the Dot Mobile Grocer just address that by being present and locating and going to areas where, a history of marginalization and oppression has led to a lack of development for grocery stores, and working together with other community nonprofits and groups that are trying to get their own food ideas off the ground and working in partnership with them has been part of the community council's kind of approach all along. But I think to the point you said about the USDA Farmers Box, something I've never seen done, and we've asked hard questions and we've been told don't ask those questions by our local partners, is where are they going? Where are the food boxes going? Because one of the challenges we're seeing is they don't share that information. We don't know which areas, which neighborhoods received food boxes. The federal government doesn't report on that. Our local wholesalers don't report on that. I think each mobile market can say where we're going and we can look at that, but we have no accounting for who received food boxes. And so not only is it on the supply side, but it's on the demand side that we need to have harder conversations about equity. And I think, just one mobile market, I don't know what difference that group makes in the national scale, but at the local scale, the community council said, we're going to go to the areas where we're not seeing food. And we're going to make that intentional in our mission about bringing fresh, affordable food. But I think it's a larger conversation that this entire, everybody in the audience ought to ask is, who's not getting served right now? Which communities are not getting access? If we're relying upon people to do drive-through at COVID food box sites, for example, who doesn't have a car? What does that talk about with food insecurity? I think the mobile markets can play a part in that, addressing that issue. But I think it's good that it's intentional and it's explicitly talked about and is an issue of health equity.
I love everything you both just said, and I would add to it that as part of the food bank, we still have a lot of work to do in the lens that we, looking through an equitable lens for our work. We in Chester County serve a rural, urban, and suburban population. And we have a pretty large immigrant population. We have pockets of poverty inside this wealthiest county in Pennsylvania. And the way our community is stratified is completely inequitable, just like everywhere else. I think the priority for us internally is educating ourselves about what that means and how best to serve our community. And we're still working on that, but I agree with Josh completely that our biggest efforts can be made on the policy front, and keeping ourselves informed about what moves we need to make. in supporting SNAP, in supporting equitable solutions to the social determinants of health, in supporting the work that our entire organization is doing to kind of lift up the community. There's a lot of questions to be had, and I think part of what we're doing here is really important in gathering as a mobile market community, because I think the voice that we have is actually really important, because we are on the ground connecting with our community and understanding what the needs are in a way that other organizations cannot and do not. And I think as this community grows, we really have a pretty large potential to affect policy, to ask the hard questions, to ensure equitable access to food. And that's what I'm looking forward to as I continue to grow in this realm, and hope that we can be a part of.
If I can just add one more last thought, because Davida mentioned earlier about voter registration. One of the most frustrating things I remember seeing was last November, our county had 1 or 2 ballot box drop-offs. And that's not equitable for 160,000 people who are staying at home during a pandemic. And when they decided to figure out where to add more ballot boxes, did they ask the community? Did they look at population density? No, they looked at it as equality. They spread them out geographically. But they had ballot boxes where maybe a couple hundred people could get to in a 10-minute drive, not where tens of thousands of people could get to it. And so it made me recognize that the way we're talking about where mobile markets go is a conversation that doesn't just exist in food systems. It's about a whole bunch of other things, but especially when Davida talked about building power with our communities. I think there's some education that we can do with our local community partners outside of food systems to talk about what that really means in terms of geography and where people are located. So I just wanted to add that because I think that's relevant to the question on equity.
Yeah, really interesting parallel. All right, so seeing no other audience questions in the chat, we're going to go to the final question. So obviously, as we're bringing this panel to a close, we want to take the things that we've learned through this COVID response and be forward-looking. So how has your organization's COVID response influenced how you will approach your work? What have you learned, and how will you carry that through to better the work that you will do?
I'll say. I mean, first and foremost, I think it, upfront, it pressure tested our operational agility, and I'm super proud of our team. And I think we have a lot to look back on that we can draw on into the future in similar instances of like crisis or just any type of hardship. I think we built up a lot of trust in one another in the work that it took to care for each other at every level of the organization. And I think that will carry through. In all honesty, the operational sort of steps that we took to counter COVID are things I hope don't exist in the future. I hope our shoppers can come back into our truck and pick out their own food, feel their tomatoes. That's really important to us. So I hope the current format goes away relatively soon. But I think online ordering is here to stay. I mean, like that's just something that we've realized gives us a whole lot more capacity in terms of revenue per hour, serving more shoppers, being a more convenient option in a lot of ways for a lot of different shoppers. And I hope Fresh Box definitely goes away. By no means are we the organization that's best suited to be providing direct to doorstep delivery. I really hope we can take some of our best practices and sort of the operational blueprint, best practices around community engagement and the operational blueprint that we built up specific to our neighborhoods and the institutional partners that we work with, and then transition that over to another group that has more of the pre-built infrastructure in terms of like transportation, sourcing, and packing. But that's not our core competency. It's not something we even wanted to do in the first place. So the team trust and the culture that we built up during COVID is something I think we'll always draw on. But operationally, I hope there's a lot of stuff that we retire.
I would have to say that the resilience of our team was also something that we learned very deeply about during this last year, and it's something that is definitely going to carry through. And we kind of learned the hard lesson that no matter what challenge arises, our team is kind of ready to meet it. So those are the super positive things. But as I've mentioned before, our connection to our local growers, I think, is the most meaningful connection for our program. I think it's the way that we're going to most positively affect our food system moving forward. And our healthcare partners have been coming out of the woodworks kind of in droves, trying to get connected with our fruit and vegetable prescription program. And I think that is just still at the start of what the potential is. So I'm super excited about that, because we were still able to continue to meet those needs throughout the pandemic. So there's a lot that came out of this that was very positive.
You know, it's hard to begin to answer the question. I think my head could go a million different ways about the logistics, about the food systems. But if there's anything I want to say, it comes back to one of the questions that was asked earlier about sustainability. For those of you that have seen at previous summits, the Dot Mobile Grocer was kind of an idea at the first summit. It was kind of about to launch in the second summit. And then the third summit, here we are, we're actually operating. But none of that happens without a mobile market community council. Trust your community members, work with them, find opportunities for them to lead, help them build their power, help them meet their goals. Do not try to do it for the community, do it with the community. I think that is the only reason the Dot Mobile Grocer was be able to even serve a single food box, let alone, 11,000, which, pales by comparison to some of the numbers that you all are putting out, and you all are doing incredible work. But if you all don't have a community advisory board, a community council of some sort, consider ways to let the residents who are most impacted be a part of the process, because that's what has let us be sustainable. A lot of mobile markets have come through Kansas City. We're, I think, the fourth that I'm aware of. I heard about a fifth one launching soon. Be respectful of the communities that are there. They have their own histories. We, in the Northeast KCK area, 20,000 residents don't have access to a grocery store, just 20,000 in one area. Well, when we listened to the histories of our community leaders, they told us the story of 39 grocery stores that used to exist in the predominantly Black community. 39. We're just another part of that story. And if all we do is come and get grants and take photos and give out some food and look good, that's not going to lift up the community's capacity to take care of itself. And so we're deliberate about letting the community have ownership and decision-making power. But I think if we can do more of that and use these opportunities to leverage resources, 20,000 people, if we just look at SNAP EBT funding, that's $2 million a year in SNAP EBT flowing through that neighborhood. Why is there not a locally owned grocery cooperative where that money can come back to the community so that they don't spend it outside their neighborhoods, and that doesn't bring jobs back for their kids to go work straight out of high school? Like, those are the type of opportunities that I think we can be a part of at a holistic level that builds up the communities we're grateful to serve. So I really hope that you all take that to heart, that if it's not a community-led process, find opportunities to look into that. We're just one example, but I think there's great models all around at this summit. I'm really excited to learn more from all of you.
Awesome. We are ahead of schedule, which is great. I'm going to bring this to a close so that no one bites my head off for going late. So I'm going to present the final slide for today. And it includes everyone's contact information from this panel. First of all, I really want to thank everyone who made the summit possible, which housed obviously this panel. I want to thank again panelists for participating, for responding to my constant emails. And I also want to thank the audience for participating. Hopefully you all continue this conversation. This is really just the surface of the efforts that happened during COVID. But hopefully you're asking yourselves the same questions that came up during this panel. How will you translate your COVID efforts, the best parts of your COVID efforts, to better your future work? So thank you, everyone. And hope you enjoy the break before the next session.
Thank you, Megan.
Thank
Yeah,
you so much to all of our panelists on the session today, and especially for Megan for facilitating. As Megan said, we'll take a short break before our final panel of the day. In case I sound like a robot right now, I can share my screen with details for our next panel. And I will also include the link in the chat. To exit out of this, or you can find it directly via the Hay Summit website. Oh, I have to copy and paste it real quick. And this will be with Frederick Laforge of the Farmer's Truck. Fred is, an indispensable part of our team, both for planning the summit and for a lot of just mobile market operations across the country. And he will be talking again a little bit about why fund a mobile market, both for those funders on the participating in our summit today, as well as those seeking funding from various sources. So the link is now in the chat, and then the details are, as you can see, on the Hay Summit event website, like the details for all of our other talks. So thank you again to all of the panelists, and we will see you at 4:25.
Thanks, guys.
Thank you, Ann and Megan. Really appreciate it.
Yeah, thanks. It was great.
Move this up as people move out.